We've been heads down and in our own work, so to have the opportunity to come here, listen to what's happening with other teams is fantastic.
One of the best things about coming to a day like this is the opportunity to meet other people, certainly within the NHS, to make some links with them, and I think often to convince them that the third sector are a really valuable partner.
It's the networking that is the biggest part of anything that you get from it. Obviously it's good to learn new information.
We are looking forward to it very, very much, because it is about keeping the person that you're supporting at the centre of everything you're doing. I think if we all keep a hold of that, then we can't go wrong.
Good morning and welcome. My name's Charlie Keeney. I'm the Programme Director for the CCG Transforming Care Programme, and I'm really grateful to see so many faces who we've been working with over the last couple of years.
You're going to be the people creating the new way of working that creates the new models of care. What's going to help you make that happen is our key question for the rest of the afternoon.
Our contention is we're all cleverer together, we all make better decisions together if we can have a different sort of discussion, and we're trying to give people an opportunity to have that discussion here and now today.
It's great to meet other people who have been utilising the NHSIQ tools.
I've already taken things away and thought, I'm going to have to do that, and I'm going to have to find out how I do that.
I've got a couple of people now that I'll be meeting again and following up and finding out what's going on in their particular patch. That I wouldn't have had the opportunity to even find out or discover had it not been for this event.
I think it's right that you should be joining together today to pause and look back at all you've accomplished. I think it's right you should be celebrating it.
81% said that we've given you tools that you can use sustainably on other changes, and again set you in good stead for opportunities ahead like the new models of care work. And 61% said we'd been effective or very effective in building capability. But collectively, as a set of headlines from an independent evaluation, that's a cracking achievement, and I think it's down to everybody in the room and the 5,000 folk who've been part of the programme over the last couple of years.
You've achieved an awful lot more in less time than an awful lot of the international evidence of other people's work.
Incredibly well done for where we've got so far, but let's lift ourselves up and go, what does tomorrow look like as well?
Certainly very interested in attending the session looking at working with integrated teams, and also we work very closely with GPs, so I'm interested to go to the big tent session and find out more about that.
Don't herd cats. So don't try and force people, because actually it doesn't work. But actually put a little bit of food out, a little bit of water, no milk, because cats don't really do milk properly. But at the end of the day, don't wrestle pigs, because you get covered in muck and they love it.
So this is the kind of the visual representation of how we wanted some of those teams to look and feel. So like that pit stop garage mechanics, all mobilising around the needs of that individual driver. I have to say it probably didn't feel particularly like that when we started this journey.
So every day we discuss, we share best practice and talk about all our patients to try and prevent duplication.
If this is our ambition, in 5 years' time, what might some local newspaper headlines look like? And I think the best one of the lot, the prize winner, was that Pharrell Williams moves to Leeds because we're so happy.
It's a bit like, I'm thinking of an armada. We've got lots of different little ships, and it's being clear about the sense of direction that we all want to go along, and actually creating that fellowship through.
We are further on than we actually thought we were. It's only been 3 months, it's very new for us, but I actually feel like we've developed far more than I think what even we've anticipated, and to hear other people praising us for what we've done, I think it's just been a big pat on the back for us.
We should be thinking about outcomes first, and outcomes for people, outcomes for populations.
What's happening in Manchester is they're integrating their budgets, their planning, their thinking and power, and they're sharing their power.
What process is in place for us to share that information with each other? I don't see one at the moment, and I don't think it's been mentioned today.
You can't replicate what NHSIQ does 200 plus times across each CCG and beyond. It has to be done on the level it's being done at already.
How far ahead do you think, as the panel think, we really ought to be starting to have our vision?
It's more than 5 years. And I don't know whether it'll be finished in my lifetime, because I think we should be in a culture of continuous improvement, actually.
Within 3 years, an upsetting proportion of people run out of momentum. And usually 2 things are agreed. Firstly, let's just revisit the data. Let's take stock, let's find out where the gaps are, let's measure this, let's do it. And then the second is, let's work hard. Come on, just do it. That kind of physical energy, just be more busy. They're not wrong. It's just you also need to recharge the spiritual energy of seeing the purpose of this and the value to get more people on board.
Don't underestimate what an incredible achievement you've had in the last couple of years. Change only ever happens. The magic moment of change is when something happens for a member of the public, a patient and a clinician in a local place. All the policy in the world doesn't change anything. It enables, but it never changes until you make it happen locally.
I think today has been a very thought-provoking day. We've been able to hear more about what others are using the NHSIQ methodology for. That's given us lots of ideas.
I think you can't help but be inspired by what people are doing. People are still out there giving it their best shot and taking on the challenges that we have in the NHS. Is brilliant.
Doing this type of thing helps us learn from each other and helps us develop our services to benchmark against the best.
You can actually see and feel the change for patients. If this can be replicated nationwide, patients will honestly get a much better deal than they've had in the past.